Psychologist extraordinaire. Looks like you're right. So I'm here with my favorite psychologist in the whole world, Dr. Elena McSwain extraordinaire. Hey, Elena.
Hey,
Thanks for talking to me today.
thank you for having me.
So we had an impromptu discussion last week about trauma, and I thought it was really good, and I just wanted to follow up on it. So the first thing I wanted to ask you is, can you give us, in layman's term, a real clear definition of what trauma is?
Sure. Basically, trauma is any distressing or disturbing experience that one can have. There could be many causes to include witnessing violence or death, having one's own life threatened, sexual violence, life-altering medical diagnoses or interventions. For example, if you received a cancer diagnosis, or if you were pregnant and gave birth to a child who had cerebral palsy, and there's going to be a number of medical visits afterward. There can be trauma for the parents. There can also be a different experience of that trauma for the child. It can also be repeated events such that military, medical personnel, or police witness. An example of that would be seeing multiple car accidents over the course of time or witnessing domestic violence. And those become layers that can impact the way one experiences life.
Right. So it sounds like you're saying there's different types of trauma. Can you run down the different types of trauma?
Clinically, we think about it in terms of, do you have one or not? The way we treat it, we look at, is it a singular event, or is it what we would term complex trauma, when somebody has multiple experiences, and they can accrue over time, if you will.
So can they be small as well? So if you have several small but biting events and they recur, I'm trying to think of a good example. So if you're growing up and your parent is constantly insulting you in a way that hurts you.
Yes.
So that will still be considered a trauma when you become an adult.
For you, as long as the individual experiences as distressing or disturbing to them.
Right.
So it is not anyone else's responsibility to say, hey, that is trauma or not. It's really individually based.
Right. That makes sense. I lost my spot, Elena. I just got this part out. So my next question is, we as individuals, when we experience trauma, how do we assess our own trauma? How do we process that?
I think on a very basic level, we have to understand, take a step back and think about, have I experienced, or are there any experiences in my life that I would label as traumatic for myself? What could end up happening is someone has had a lifetime of traumatic experiences, and sometimes you may hear people call those small traumas. Example, witnessing community violence. So if I take somebody who grows up in a city or a country where there's violence happening around them, where it is normalized, so there's a shared experience by everyone of what is occurring at that time. One may not necessarily label it trauma because for them it is normal. This is what they witnessed over time. However, coming from the outside looking at it, I can say, oh my goodness, that is trauma. They just may not have an awareness of it. So sometimes it takes somebody being able to look at it and say, oh, wow, these were traumatic to me. These events do influence how I navigate life. From there, then they can decide, okay, now that I've identified this as a trauma, let me then look at, how does this affect my life? How has this shifted the way that I navigate my relationships? And then how then do I come to make sense of this event in my life and move forward?
Okay, so in my experience, because clearly I'm not clinical and you're clinical, but anecdotally, so in my work with helping women who have survived abuse and working with at-risk teens, most of the people practice avoidance of trauma. They diminish it or pretend that it didn't happen or compare themselves to others, and they go, oh, well, that wasn't traumatic because this person experienced worse. How is that for you in your clinical work?
That is very common, actually. So if I were to be working with an individual around trauma, one of the symptom clusters includes avoidance. It's avoidant behavior. If we have an event that occurred in our lives that was incredibly painful, then we tend to avoid that moving forward. And that's natural. Example, if I touch a hot stove, I'm going to pull my hand away. That's avoidance, right?
Yeah.
Stove is hot, it hurts, I'm pulling my hand away.
Yeah.
Same thing happens in our emotional life. We have something that can be painful to us, we touch it, we pull away. And so it's not necessarily a conscious thought, it just occurs. It's automatic, it tends to be natural, and over time it becomes a learned set of behaviors so that it becomes normal for the individual to avoid because it's a painful place.
You mean like if they're recalling their trauma or something triggers memories of this trauma, they diminish it so they don't have to deal with it?
It may not even be an active avoidance of it. It could just be their brain knows, oh, this is reminding me of this trauma. Let me veer away.
Right.
It may not necessarily be conscious for them. They just know, ooh, I don't like this. This is, their brain knows, not on the conscious level. And I speak about the brain as if it's a separate entity because it is. Our brain does a lot to protect us and take care of us in ways that we don't consciously know. And a lot of times trauma reflects that. Is our brain taking care of us? But it may not always be helpful in the way that it does.
So what you're saying basically is it's a self-defense mechanism. We're looking after ourselves.
Yes, but not in a conscious way.
Yeah. I got you. Because that then makes me think, what about our diminishing other people's trauma? So we compare our trauma to other people's trauma, go, well, I went through worse. So what you're going through is not so bad.
Yes. I think as humans, we tend to compare ourselves, right? The reason social media can thrive in the way that it does is because we're always in competition with one another. And that can manifest within our life experiences as well. Oh, you went through that, mine wasn't as bad. But that's not helpful if that leads us to a place where we don't address what's going on in our own lives. And we can't accurately compare because it's apples and oranges. So if you take two individuals, they're going to have different life experiences. They have a different set of genetics. They have a different starting point when it comes to resilience. So did one grow up in a relatively safe environment where parents taught them good coping skills and somebody didn't? Then the person who had all those resources when they experienced trauma may fare better in the long run. But the person who didn't have those resources may not. And so they can experience the exact same thing, have very different responses to that. Because they have different tools in their toolkit for coping with it. And so it's not helpful to compare because it can then lead to not addressing. And then in doing so, a couple things can happen. One, oh, it's not as bad. And then there can be guilt when they do experience the ways that it limits them. Because then that negative self-talk can sound like, oh, it's not as bad as what so-and-so experienced. So I shouldn't be feeling this way. And then we get into the shoulda, coulda, wouldas.
Mm-hmm.
And that just adds another layer of possible guilt and shame on top of whatever impacts they had from the trauma in the first place.
Ooh, let's talk about the impact of trauma. Well, I don't want to gloss over that. So let me just reiterate. Hey, folks, don't compare your trauma to other people's trauma and don't diminish your own or other people's trauma. It is not helpful for you or them. Mm-hmm. It's just a roadblock to healing. But let's talk about the impact of trauma.
Yes.
Tell me about it.
So there, across our life, it can hit different domains. And so the areas clinically that I focus on is intimacy, safety, trust, power and control, and esteem. So if we conceptualize trauma as a set of sunglasses with which we're viewing the world, or regular glasses, however you choose to think about it, it changes the way we look at situations. And it can change the way we look at ourselves and the way we trust ourselves and the way that we look at others and or trust them. So I think relationally is the most important. It affects the way we relate to ourselves and to others. So when I think about that, trying to give you a good example of it. Trauma is like an alarm system on a house that's faulty. So an alarm system, when it works properly, if somebody's trying to break in, the alarm should go off. Mm. With a faulty alarm system, sometimes that alarm can go off when nobody's trying to break in.
Yeah.
And then sometimes it doesn't go off when someone is trying to break in. And because of that, what can happen for us is we recognize I can't trust my own body because my alarm is broken.
Yeah.
So how then do I know when I'm safe and when I'm not?
I've never heard that analogy before. That is so good. So, yeah. So the impact of trauma is like a faulty alarm system on your whole emotional processing. And that's deep. I get that. I think we've all seen that in people. Mm-hmm. All right. So what advice do you have for people who are managing trauma in their life, big and small, complex or simple?
Come to therapy.
Get some help.
Good therapist. Yes. And I would just like to say, finding a therapist is like dating. Mm. It's really important to find a good fit for you. And not every therapist is going to be a good fit. So sometimes it takes trying a couple folks out before you find somebody that you click with. Because the greatest predictor of positive outcomes is the relationship you have with your therapist. If you don't feel safe with that person, if you don't feel heard by that person, you may not get the outcomes that you'd like. Okay. So that's really important.
That's fair. I myself have told people that. Mm-hmm. It's like not everyone's personality, just as a therapist, their personality might not suit you. Not just their therapy style. So give it a while. Find the right person. Then get into that long-term commitment to healing. That's what you got to do.
Yes.
All right. So my last question for you is, what's your message of hope surrounding trauma?
That we can find a new normal. Mm. It's always possible to find a new normal. The ways that trauma can affect our lives does not have to stay that way forever. And if you're intentional about it, then that can shift. You can shift your trajectory. And it may not feel noticeable in the beginning, sort of like weight loss. When you start to lose weight, you may not be able to see the difference from week to week. So if I'm on a weight loss journey and I lose 1 pound between today and next week, same time, I may not physically be able to see the difference. But over the course of time, if let's say I lose 1 pound a week for 6 months, there's going to be a dramatic difference. The people around me will notice the differences. And it may be hard for me to see it because I'm living with myself. It may be hard to see in the day-to-day, but over the course of time and when we reflect, then we can see the gains.
That's awesome. Thank you so much for sharing your knowledge with the world.
You're very welcome.
You're being very generous. I thank you. All right.